Hello, everybody. I had asked if there were some questions on TKM Talk, so we're going to try to cover those. And let me jump right in here and start addressing these questions. So one of the questions is, and I don't have them in a particular order, one of the questions is from Letty about safe sleeves for phones. I don't have a safe sleeve to show you, but I am familiar with them. Let me tell you a little story. For instance, my daughter got one for her phone. And based on everything that I've known so far, I thought, nope, not going to work. So what did I do? I get the meter to test it and to find out. And to my surprise, it really made a big difference. And that didn't make sense to me because so much of the phone is still accessible that can radiate out. And they call it proprietary, so they don't tell you what's in there to make the difference. It would help. So I was, puzzled about it, but happy about it. And then a while later, I had a client come into the office and had one and asked my opinion about it. And I said, well, the one that I have tested seemed to test out good. Let's test yours and see. So tested theirs and it tested bad. It really didn't make any difference. And I'm saying, what's going on here? So I went back and tested my daughter's again, and it tested bad. So I'd have to run a study on it. I'd have to get some new ones and keep them from a period of time. But just observation, what happened is apparently when you get them new, they seem to work. And then after a short period of time, they don't work. And since they don't tell you what it is that they're doing that's supposed to work, I have no idea of how to study that aspect. But instead of these two scenarios, I would need more new and older ones to compare to. Because all the older ones that I have checked that are not brand new don't work. And the new ones, which I've only tested one, works. So I need more comparison. So bottom line, that's the information I have on safe sleeves for phones. Another question came in from Joyce. Said, we'd like to know what is the best sequences, there's that best word again, to do for memory decline, great question, or to keep from getting worse. Very good. How often, etc. So there's a lot involved there because I don't have a person. I have a question about a generic label. So I can give you general statements. So here's what it is. Applications. You want to keep the waist level open because we're talking about memory. Memory deals with energy spheres number 20. But it's dealing with the head, specifically the brain. We know it's the central nervous system and the core of that. Therefore, the 5, 6, 7, 8 sequence, that combination 5, 6, 7, 8 is a very good sequence to do. It's mostly working below the waist and mostly in the feet. But if you'll notice on the page what it relates to the brain and powerful for the waist level as well. So concerning memory and decline, I find a big difference, especially as people age. Bowels are critically important. If your bowels are not moving properly, your thinking and your brain and your memory is going to decline rapidly. Even if you go through a spell of constipation, which you may not think constipation because the majority of the public is chronically constipated to one degree or another. But if you have a decrease in bowel movements where you were having better ones and you're having like one bowel movement a day or less, you could find that your memory and your thinking and your stamina and everything starts declining. We've got to move the bowels. Please remember, almost as many neurotransmitters are in your gut as they are in your brain. We've got to keep that detoxed and moving. So what else? Activity, physical activity and mental activity. You need to keep the mental active, especially in ways of challenging it, doing things different, doing things new, having to reason and think things out, not just active, doing repetitious stuff. That doesn't work. And physically active, you got to keep your body mobile. Diet, of course, is very important. So we could get in depth into that. But TKM sequences, you want to add in gallbladder sequence. And I've already mentioned the number 20 sequence, but the 20-21-22 sequence is very important. What else? Liver sequence. Why? Because the pathways go directly through the cerebrum. So they go through the brain. And another one that's very important because, come on, there's so many that we could talk about that are related and important, that are close related. And then there's all the other ones that have some kind of connection. But fours, they're directly connected. Read on the energy sphere number 4 page and see all the things that it relates to mentally. For instance, that's the only one that's talking about dealing with your capacity, which means IQ. IQ means capacity, not knowledge. So to help brain capacity, so fours are very important. So I hope that helps. The other thing in relation to TKM, find out what your obstacles are, checking pulses. Find out what the repeated patterns are that are in the way when you're trying to work on other things and your body is redirecting it to what it knows is priority. So get the priorities dealt with so that the work that you do will be targeted towards where you're working. Another question, this is from Janice. It says, tingling in right arm and hand. I gave blood about 1.5 years ago and the nurse thought she was in the vein. This happens all the time. Was in the vein, but it was working. So she left it. Well, it was working. Maybe, maybe not. I wasn't there, but you know, it can bleed out into all over the place when it's not. So you noticed, she noticed, was saying, I noticed this tingling for a while after this, and then it became just once in a while thing. Any idea? Well, if it's a tingling, I don't know how much time period you're talking about, but it sounds like the pressure on it and different things that happen, maybe the blood getting to the vein, so affecting the vein. So that is physiological, but don't forget the energy pathways that go through the area. Could you get tingling from interfering from the energy pathways from this? Plus, what was not mentioned is, did you bruise in the area? Did you have a knot? Get very painful aside from the tingling? Those are confirmations that they missed the vein or they went through the vein, which also happens. And you have even more of a bleed out. So for the damaged nerve aspect, energy pathways aspect, spleen. Spleen, especially for nerves, and also helps the energy pathways. What else? Large intestine, because it's the arm. Remember, it's one of the finger sequences. Mediator, because it goes through limbs. Small intestine, because that deals, you know, like when you have a shaky hand or something and small intestine becomes one of the top priorities because it deals with central nervous system, goes to the hand and arm. Hold fingers, especially one at a time. So, you know, thumb, and work yourself around, not that quick. The longer you hold it, the better. In any particular pulse that you feel that is pounding or particular textures that's not cooperating quickly like the others, then what I'd like you to do is hold that one a lot longer and more frequent. Or if you have one that has no pulse, hold that one a lot longer, because then that's getting specific into an area that needs more help. So don't help them equally after you determine how they're functioning. Help the ones that need more help longer. Also, if there's somebody to work on you with a special sequence. So here's something that's not in the book. First off, let me also add, get waist level open, because it's going to deal with that area. Keep waist level open. And a special step would be someone to hold your same side 9 as the arm that's tingling and work each finger while you're holding that 9. And while they're holding that same side 9, hold the 19, 18 to 17 to high 19. Another way to say that is hold every energy sphere location and correlation on that arm, descending and ascending while they're holding the 9. Do you want to be more thorough? I've done this with people many years ago with paralysis of the arm and not understanding exactly what the course is, but covering the bases. So here's what I did. After this, what I just said, then I moved my hand from the same side 9 to the same side 10. And then I repeated that whole process, working to 19, 18, 17, high 19. And when we're talking about high 19, I'd work front and back. 19, I'd work front and back. And working the fingers as well through each finger. Usually always thumb first and then work your way around to little finger. That is very, very thorough. How do you do this? Most everybody's saying, well, I'm trying to get up to 5 minutes per step. The goal is to work it until everything that you're touching, especially if it's a digit, that all 3 sections, sides, top and bottom, everything, it's pulsing synchronized with the other location and the texture of fluff with tone. Then you might hold that for an extra minute or 2 and then let go and move to the next step. That's what you hold it for. When you're holding it for approximately 5 minutes a step, that is just before TKM 101. That's for people that really don't know. And you do like what we do with our median handout, where it says you hold it for an average of 5 minutes up to 20 minutes. Well, everybody goes for that 3 minutes to 5 minutes. Why? Because it's shorter. Duh. But you forget, the more you shortcut it, the more you shortcut yourself in your recovery and the longer the recovery process takes. If you do it very, very thorough, you might knock it out in a session versus working on it for a month or 2. So pick a time, dedicate to yourself, for your health, and do this extended. Now, that what I just explained applies to everything we will talk about or ever have talked about applying TKM. Applications, quick steps, special applications, all of that. So I hope that helps. If you find anything in textures or pulses that requires more answers or investigation, please let me know. This is another one from Lisa. It says, I have 2 friends who have contracted COVID. A lot of people have contracted something. A lot of it is the symptoms that are talked about of COVID-19. So bottom line, it's saying, could they benefit from, they could benefit both from TKM with their lingering symptoms. So the question is about lingering symptoms and advice regarding time that should wait between the contagious period, which is a concern. So the contagious period for people that have COVID, according to common agreed knowledge, is 4 days after they have no fever whatsoever. And that means that you're actually checking the fever, because if they've been having fever and they feel better, they might have 1 or 2 degree temperature and not realize they have some fever. So I mean no fever whatsoever and you're fever free for 4 days. Then your contagious period should be after, it should be gone. Although they still may have fairly severe lingering symptoms, lots of congestion problems, very much fatigue, all of these type of things. Also, what general sequences would you recommend for lingering symptoms? Cough, fatigue, low-grade depression, very important. So here we go. Number 3 sequence, that's top of the line. And for those that may not know about number 3 sequence, on these informational shorts, go back to informational short number 3. And it will tell you about that in detail and give you some special aspects of how to utilize it beyond what's in the book. Now, it is the only sequence in TKM that has a prerequisite, and that prerequisite is a 15 sequence. So 15 is good, and 3 is vital. I'm named that as number 1. And if you've got somebody, let me open this up a little wider. If you're a family member or someone that's going to be around somebody that's infected, then this also is the primary one to do during the major part of the infection. For high fever, all of those things, that is the primary one to do repeatedly over and over, very extended time per step to knock it out. Knock it out. Third method of correction, is another important sequence for the lingering symptoms. 13 sequence, because of lungs and congestion, hormones, cough, all of these type of things. Does it help with low-grade depression or deep depression? Directly, yes, it does. Does it help with fatigue? Yes. Something else is spleen sequence. Now, let me mention something else that's not in TKM that I've found that's been very, very helpful for those that have it or can get access, and that's far infrared. Far infrared, especially on lungs and sinuses, the head. So the head and lungs, because here's the deal. The problem with the lungs is coming from the sinuses. So if you only worked one, work sinuses. Guess what? If you work lungs, you're working symptoms because you're having this postnasal drip, and the people can say there's nothing here. I'm breathing fine. I have nothing. That's not true. You've got postnasal drip that's going back there. And especially when you're laying down, a lot of this will start. That's how it gets into your lungs. That's how your lungs get infected. So you want to address primarily cause to stop cause. That's sinuses. Then you can address secondarily the lungs because they can get enough mucus and dysfunction in them that can get an infection that can be very serious. So another one to incorporate non-TKM is essential oils. I can get you a list of this later. We got some other questions to tap on. And also this is going to be part of another question that we're going to dedicate probably an entire informational short on that next time. So essential oils. We personally use Young Living because no matter what the marketing and opinions are, through years and years of working with clients with very serious disorders, I find that the medicinal grade, treatment grade for health has shown to be best. So we use those and we use them. Some of that is external. One of the ones that you can do is called RC. It's a combination. Great for topical, for sinuses, for chest, for all that stuff. I even put it on the back. It's got a lot of, aside from the other oils, it's got a lot of types of eucalyptus in it. So other ones that you're taking internal, my suggestion with that combination when we get to that point, not in this lecture, but next one, is you'd be taking about 2 capsules 3 times a day or more. You want to really flood it. And we're also going to talk about some other things. So this is mostly the TKM correlation of this related to the specific questions and some added benefits. I can't say enough about incorporating far infrared rays, not near, not mid, but they have shown to have a bit more of a rapid results in symptoms and overall shortening the long, because some people I've seen, they have it for a week, couple of weeks, lingering symptoms for that, or they have it for a couple of months, or they have it for 6 months or more. Everybody's different. So we got another question from Carol, is how to treat nasal polyps. And niece has asthma. So let's talk about nasal polyps for a minute. Polyps are more of a problem, she says. Even after surgery, they grow back. Yes, even more. It's the programming of the body, except it's more difficult, and especially with TKM, because the scar tissue is there. But you do stomach sequence and small intestine sequence. Those are priority. And all applications in second stratum. So stomach, small intestine, and all sequences in second stratum. Concerning the asthma, you always want to remember the EMT for asthma. Plus, the core cause of asthma is fourth stratum. It is cause level. So primary things there are 23 sequence. Of course, 23, 25 is great. Kidney sequence and bladder sequence. Kidney even more than bladder for asthma. Another one to deal with symptoms is second stratum. Lung, number 10, and number 3, energy spheres are primary, among the other things that you can do in second stratum. Then there was a second question, how to treat a shaky hand. Parkinson's was ruled out by a medical doctor, but it has gotten progressively worse. So what we use for, let's say, Parkinson's or Parkinson's symptoms comes back to what I've already mentioned before about arm, hand, and fingers, small intestine. So you want to work small intestine sequence and heart sequence and mediator. I would work small intestine sequence a lot. Now, here's the deal. If it's shaking all the time and you're doing these sequences, again, I'll say this, but it should be a given for every answer for every question. Are you checking pulses? Are you looking for patterns? Do you see repeating patterns or persistent things that are things more loud or the things that are more chronically silent to get that resolved so the work you do will be more efficient? I can't say that enough. It's how you get the profound results versus, well, I worked on it. I tried this. I tried that. The other thing is when you're doing these sequences, small intestine, heart, mediator as priorities, when you're doing them, do you notice a difference in the shaking during the time that you're doing it or afterwards? If you notice something more with one than the other, do that one more thorough and more frequent, much more thorough, because you found something that is hitting right on where the obstacle is. I hope that was of help. Give me feedback on how that works for you. Let's do this one. This is from a different one from Janice Enfield. I went to the dentist for a cleaning and they did the every 5-year full x-ray of the mouth and noticed that my bone, I assume jawbone and upper bone, is starting to deteriorate. That's not good. So there's a question about 2 abscesses below the nose. So I assume that your incisors. Checked on them in 6 months. So check on them in 6 months. That's you might want to try another dentist because if those are abscesses, goodness gracious, you don't want to be waiting 6 months. Reading further, how can bone deterioration and abscesses be treated with TKM? So let's talk about abscess for a moment first. Tea tree oil. So an oral grade tea tree oil or melaleuca with baking soda to brush your teeth with very thoroughly and floss. Flossing, you can take and put a little, I'll just simulate here, whatever that is, and you have a little baking soda and you put a drop of tea tree oil on there and then put that in your finger and pull your, if it's the string floss, then put it in your fingers and pull that through, and so it's on the floss, and then floss your teeth so that it's also getting a very powerful antiseptic and some abrasive so that it's cleaning it off. Do that after every single time you eat. If you want to take care of gum problems, infection problems with gums, abscesses, different things like that. Do not use fluoride. Change if you're using fluoride to a non-fluoride toothpaste. And I suggest using the tea tree oil and the baking soda versus toothpaste until you find a good one. But especially during the time of infection, just keep with the tea tree oil and baking soda. I had this question recently, a couple of weeks ago. The doctors were talking about it and they had this problem. I suggested it. They got back with me very soon and boom, it was taken care of. What sequences? Large intestine sequences primary, wherever it is, and check for any special bacteria or virus which could be causing these problems. That's what we do. We have special ways of running tests that we have found very unusual things because we run it what we call a filter on the gums and teeth. And that means it's checking everything that we have to check to your gums and teeth. And by doing that with special things like deteriorating bone, teeth are about to fall out, gums are greatly receding, that we have found some unusual bacteria that is deteriorating all that away that they've already been tested for by their dentist and doctors, and they didn't find it. So unless they test for these very rare things, a lot of times they don't find them. So I would advise that as well if the other things don't work quick enough. Let me know how that's going. So here we have another question from Linda, talking something a little bit related to what we mentioned earlier, brain health, nervous system, and how TKM can help, which sequences can improve, as well as diet and lifestyle. Well, diet and lifestyle is getting into a big topic. So we might want to touch on this further later if this is not satisfying, which this really needs more time. How to help more serious health concerns such as cancer and dementia. Stratum correlations. So as you can tell, those are big subjects. So concerning the nervous system, spleen is always a given. You could exchange the name spleen sequence to central nervous system sequence. So that's good for any and all things. We've already mentioned about brain health, and brain and waist level are synonymous. And also remember the gut, which correlates to the waist level, even though some of that extends down into the hip level. Diet and lifestyle, that's going to take a bit longer. So if you chime in here and ask some specific questions, we can do that, but I'd like to hold that for more. So these last two are related. This is from Frank, and it says, given some of the political ramp up on COVID-19, it might be good to have some insight into using TKM to help prevent side effects or detox from the effects of the vaccine in the event that people are forced to get it. So first, let me say, you'll have to tie me up and knock me out to give it to me. Well, if they say you can't fly, then I guess I won't fly. If they say this, that, or the other, people are not understanding the serious dangers and potential dangers of this vaccine. And you will not begin to understand the impact for a minimum of 3 to 6 months from now. They've already started giving them. And if you ask me, like so much disinformation that's been going on, I think a lot of that, like already the initial deaths that have happened as a result of it, aside from the negative reactions that have happened in this country and other countries that they're reporting, they're going to hush it up. They're going to hush it up as much as they possibly can. People will know, that's going to leak out, but how much of it's going to be happening, that's going to be very hard to determine. Why? Do you really think that we have honest, clear media? Whoa. So this second question is related. I second what Frank suggested. You've discussed aspects of COVID before. Perhaps you could devote a Friday to some in-depth post-COVID. That would be very good. We did a little bit of that. So post-COVID info for use in long-term recovery and or vax detox. So let me talk a minute about vax detox. This is not like any other vaccination. And I am not talking about all the things that you find on social media, the things we even have posted on our preparednessinfo.org site under updates. I'm just talking about the biological aspect related to your chemistry that virologists, biologists, and all of your top experts in Europe and here that are non-biased are talking about, that are aware of these things and their research and science that have been available for many, many years, but have never been used. Why? Because in using these in trials on animal experiments, there was way too high of a death rate. And then they explained very simply, which I will do in next week's lecture. I'll bring a part of that video, that they will explain the chemistry reactions, the RNA and DNA of how your cells react to this. So there is no political aspect to this. There's no extra stuff that a lot has been talked about and planned. And some of these things have been talked about and planned for 15 years to get into a vaccine. I'm not talking about any of that. I'm talking about one simple aspect of the name of the vaccine, mRNA, RNA aspect. And Moderna comes out with one that's called RNA. They're dealing with your RNA and coding to affect your body like nothing has ever existed before. And of course, they got a lot of hoopla to say it's great. Just wait and see. I have urged people, goodness gracious, if a fraction of what happens, just the biological aspects, dealing with your chemistry without any other things, just a fraction of that happens, guess what's going to happen to your parents, your children, that you have a concern for? Maybe you want to get the vaccination because you believe that it will help. Well, you need to get educated and not by any biased sides or any kind of extra things that are political or anything else, or ulterior motives that people that are saying that might be involved, and they very well might be, but I'm not talking about that part. I'm just talking about the basics of how the RNA vaccine affects the cells and the immunity from that point forever. Please, please pay attention to that. I sent out a notice to everybody. I got lots of feedback that appreciated that. And they did, a lot of them told me that they did what I hoped they would do, was to send that notice out to as many people as possible. I've gotten one that sent it out to a relative, and of course they got slammed saying, you don't know what, and they copied and pasted some standard publicized medical reports, which is promoting this, okay? So we're talking about non-biased experts. It's important to get some non-biased opinions. It's like if you're going to purchase something, do you just check out what the marketers say about it? Please, that's not using common sense. So yes, I've decided that I didn't have time for it this time, and I don't even know if an entire informational short lecture will be enough next time, but I will directly relate to these things with TKM aspects, some other health aspects for during an infection, post-infection, and things related to vaccine. And I really invite you to tune in and ask your questions, and I will answer them to the best of my ability on the facts that we know, not on theories, but the facts that we know. So something else is very, very important that I wanted to mention is texting 7-10-10. What do you do that for? So we've partnered with Gateway Church, and I want this to be available all the time, and they have plenty of wonderful, wonderful people to address these. So if you text 7-10-10 that you need prayer, you could simply text prayer to 7-10-10. Or you could, if you're ready to receive the Lord, or, maybe there was a really, really great message the other day on people that received the Lord as a child. And that's great. My granddaughter did not long ago. But then again, when you're of the age where your frontal lobes are developed, you might want to revisit that. You might want to dedicate yourself over again if you haven't. And then there's those that haven't for whatever reason. Maybe you didn't know. Maybe you have issues with religion, and I'm not talking about religion. Or maybe you've been hurt by a church or by people. Well, that's by people. That's not God. What I'm talking about is a relationship with God. So whatever the issues that are common to mankind that distracts us from truth, boy, I could preach on that for a long time, is I can't think of a more important time. It is so important to realize that it is so much better to live in this world, in your body, in your life, with God than without. So you could also text decision to 7-10-10, and someone will contact you. We'd be more than glad to pray with you to receive the Lord. We'd be more than glad to pray with you for any prayer needs. You can contact us, and you can also contact them. So I urge you to do that. And until then, God bless you, and we will see you on the first Friday of next month. God bless you. Have a good weekend. Bye-bye.